Hello, ladies and gentlemen, and welcome to WION Health Pulse, co-powered by Arcus Hospital and Continental Hospitals. Special partners, Sarvodaya Healthcare and Eureka Forbes. Associate partners, Oxymed Hospital and Apis Honey. How are you? Well, it's one of the simplest questions and perhaps the least honestly answered. A polite question which is usually followed by an equally polite answer. Now, most of the time, it's just social protocol, but perhaps not today, not in this room. Because health is rarely as simple as good and not good. A doctor knows this better than anyone. Now, if you walk into a doctor's office feeling unwell, one of the first things a doctor does is check your pulse. Such a simple act. 2 fingers on the wrist, and within seconds, it can reveal a great deal. Now, pulse doesn't tell a doctor everything, but it tells them where to look. It reveals patterns, it signals stress, it hints at what may be happening beneath the surface. And today's summit in many ways is an attempt to do the same thing, but for healthcare. Now, to understand what is changing, what is working, and what is under strain, and what the future might demand of us. Because healthcare may be delivered locally, but its challenges have never been more global. Diseases don't recognize borders, neither do pandemics, climate change, technological disruption, or misinformation. And perhaps nowhere is the idea that the world is one more evident than in healthcare itself, which is why conversations like this matter. And so over the course of today, we'll seek answers to some very important questions. Who gets access to healthcare in an increasingly unequal world? How do we talk about mental health with greater awareness, empathy, and nuance? What happens when artificial intelligence begins making sense of our bodies before we do? And after all the innovation, disruption, and progress, what does it actually mean to live a healthy life? Over the next few hours, we'll explore these questions through the lens of economics, technology, policy, innovation, and human experience with some of the brightest minds and most respected voices in the healthcare ecosystem.
What good is a 6-figure salary if one is too drained to enjoy it? Is it truly wealth if it comes at the cost of one's health? It is health that is real wealth, and not pieces of gold and silver, said Mahatma Gandhi long before the age of rushed deadlines, smartphones, and social media. But his words don't feel archaic today. In fact, they resonate even more in our fast-paced world. Today's world is a world where gym memberships are rising, dietary supplements are filling the shelves, and wellness retreats are more popular than ever before. Despite the growing awareness, lifestyle diseases are continuing to rise across the country. To decode India's healthcare landscape, WION brings together the country's leading healthcare visionaries, policymakers, innovators, and change makers. All convene on a single dynamic platform to discuss themes that matter to you, examining the disparity in healthcare and the availability of medicines globally, assessing responses to the overwhelming demands of the modern ecosystem, exploring whether intelligent agents will take over humans, and finding the right balance between cure and care through alternative medicines. Welcome to WION Health Pulse 2026, a conclave aimed at cutting through the noise with expert-led discussions. Our goal is just one: to empower you, our audience, with information that is clear, accurate, and actionable. Because the real wealth that transforms lives indeed starts with good health. And that is the rhythm of the new health order.
Before we begin, it's important to take a moment to reflect on why a gathering like this matters. To welcome our guests and set the context for the day ahead, please allow me to welcome on stage Managing Editor of WION, Mr. Ravin Sharma.
We started by saying you can have 1,000 problems in life till you have a health problem, then you only have one. Everything else, money, relations, stress, all fade away in the shadow of it. When your health is compromised, every little thing becomes harder. Dreams shatter. The color of life begins to fade. Health is not something which we merely manage. It is something which we respect and have to respect. Taking care of health isn't a luxury. It's an act of responsibility, love, responsibility towards self, the family, the society, and globally to make this world a better world. A very good morning, ladies and gentlemen. Welcome to WION Health Pulse. We are honored and privileged to have you all here amidst us. Today, we'll dwell upon the big questions that stare us today, and more importantly, the message, as my colleague pointed out, that nowhere is the idea that world is one more evident than world healthcare. When several health conditions have moved from the margins to the mainstream, the invisible pandemic that we have to say to, that it is okay not to be okay, to break that taboo. What is the right balance between care and cure? Is there a red line for digital integration in health? Given the infiniteness of the developments around us, and with India setting an example as the world's Pharma, the need for breaking the health imperialism practiced by several countries, it's all the more important we discuss this today. In a scenario when we just cannot think of the ongoing wars impacting one and all, one is tempted to draw a parallel. Our body as a finest miniature cosmos, which essentially means harmony. As the war and conflicts keep unfolding across the globe, we also have several battles and conflicts going on inside us, our bodies, most of them though invisible for a long time. While the external battles, as we discuss it in our newsrooms, have an alternate mechanism, which we call diplomacy. There is no diplomacy that you can have with your body and health. And if at all you make a deal, at times, it cannot be a Trumpian one for sure. Then there will be another conflict within. People come and go, but you remain with yourself from the first breath to the last. Respect your health, and you will have a memorable journey, perhaps the most tender truth. The body whispers, then speaks, and then finally demands. Let's begin the conversation with our esteemed panelists and audience in identifying the whispers of our bodies before the demands become too big to fulfill. Thank you, and welcome once again.
And sir, now, usually finding yourself in a room full of doctors isn't particularly a good sign. But today, however, is a very welcome exception. And since we have so many experts gathered under one roof, I thought we'd use this opportunity to settle some long-running debates. May I please invite my colleagues Taramjot and Nikita to take the floor and put to test what we know about our health and where we need to get a second opinion.
Thank you so much, Deeksha. Welcome, ladies and gentlemen, to this incredible conversation that we're about to start. But before we start getting answers, we first start asking some questions. Now, all of our health, we look at parameters at a rather blanket scale, and because of which we do not understand the difference between what may actually be a fact versus what may be a myth or something that we believe in just because we've been told so for generations, or just because a friend shared a WhatsApp message. So how do we learn to distinguish between those things? And what exactly do we know to be true or to be false? That is now the question first, before, of course, we weigh in with the experts. Nikita, the first question, please.
Thanks so much, Taramjot. As Taramjot suggested, we've grown up with hearing these health claims, some of them from our friends, family, all in good faith at times, but, one must not just trust what we view on the internet or by hearsay from our family and friends. participants. Starting with the first question. Now, this is a very common health claim that we get to hear probably on a daily basis. So let's see if this is a truth or a myth. And I would request our audience members to kindly just raise your hand. And if it's a myth, would you like to clarify that with an explainer? That'll be great. Because all of you honestly look very intelligent to me. So let's just start this morning on a very healthy note. The first question is, eating carbohydrates, do you think that automatically makes you gain weight? Do you think this is a fact or a myth?
Yes,
Yes.
we have someone there.
Hi, good morning.
Good morning.
I'm Joydeep. I think it's a myth.
All
Because
right, and why do you say
carbohydrates,
so?
It's required, to perform a daily activities like simple daily activities like walking, going around. So I think it's a myth. Obviously, it should be in the intended proportions. If we overdo anything or something, it will always be, negatively affecting us.
Right. That's a great answer. Thank you so much. That is clearly a myth. In fact, just to add to that, weight gain occurs when you consume more calories than you burn. That's actually the fact here. Regardless of whether those calories come from carbs, protein, or fat. And whole grains, fruits, vegetables are very rich nutrients in carbohydrates that support good health. So eating in moderation is the key.
Well, before we move further, we do have small gifts for every right answer. So I hope this encourages more people to participate and come up with the correct answers. Thank you so much, sir.
Thank you. You want to take up the next question, Dharmendra?
Yeah, absolutely. This is one of my favorite questions. And it's something that you hear a lot from the older generations. Now, whether this is a fact or a myth, we want our audience to tell us. Cracking your knuckles causes arthritis. Fact or a myth? Any takers to the question? Sure.
Hi everyone, this is Pankaj Gupta. I am from Adobe. I am no health expert, but I know that cracking knuckles does not create arthritis. It creates very good sound and removes some of the boring things. So very interesting to crack knuckles. Thank you.
But that's the right answer, and I think a lot of us working professionals will find ourselves doing that often at work.
Right.
But you're right, sir. Cracking knuckles does not cause arthritis. It's usually a sound of gas bubbles being released from our joints, right? So there are no studies at the moment that prove a direct correlation between the two things. So that's the right answer. You get a gift, sir.
Thank you so much. All right, the next question, again, something, we've been hearing a lot about plant-based diets these days. So do you think that plant-based diets can provide all the protein a person needs, especially, of course, for the vegetarians in the house? Do you think that's true or a myth? I can see you nodding, sir. Yes.
Hi, good morning, everyone. So, my name is Shubham, and I am not, a dietitian, but because I am a usual gym goer, so I can share my experiences. So when initially I started my workout, it was very difficult for me to get the right foods. But just because we do not have the right information, and just because people who are living in the areas which are far-fetched than the main cities, they have lack of information, and that is complete myth that plant-based food cannot provide the entire protein. But because I usually take grains, pulses, and usually, as you know, sattu and all these diets which are very cheaper than the non-vegetarian food, but actually I manage my overall protein intake entirely in a very right manner. Just that I have to eat more and have to take care of my diets more often. Mostly after each 2 to 3 hours I eat something, but it can definitely provide you the enough protein which a vegetarian like me sitting in the room thinking that it cannot provide. It can definitely provide.
That's absolutely right. In fact, thank you so much for that wonderful answer, and you explained it really well. And we have a live case study here proving that yes, plant-based diets can provide all the essential nutrients, especially protein, in your body. And it's just a myth that you need to be a non-vegetarian, to acquire all the required protein. Thank you so much for that wonderful answer. Very well explained. Thank you.
Okay, we have one final question before we move ahead with the first session of the day. Sir, a little memento for you first. Thank you so much. All right, this is one of my favorite questions because this is something I personally do a lot, guilty as charged. But the question or the statement is the 5-second rule when you drop food truth or a myth? So if you drop it in 5 seconds and quickly pick it up and eat it, is it safe? Is it not safe? I'm looking at medical experts, give me an answer, but sir, I'm going to have to ignore you respectfully. We're looking at common folk answering it, please. Yes, sir.
So it's a myth. I'm Rajiv. I'm Rajiv Tandon. I come from a biotech company, US biotech company. Not a health expert, but yes, it's a myth. Once it is dropped on the floor, whatever, if it is infected, it will get infected. The answer is simple.
Well, you're absolutely right. It does not clearly take 5 seconds for bacteria to jump onto food particles once they're on the floor or on any unhealthy surface. That's absolutely correct. But yes, I do know that a lot of us do end up doing it. We quickly...
I still do.
I think we definitely do. We do it with a lot of our favorite foods. If we drop a morsel of something and quickly pick it up before counting to 5. But thank you so much, sir. That is absolutely correct answer. Thank you so much.
Thank you.
Gita, that was a good reminder that when it comes to health, there's often a fine line between what we know, what we think we know, and what we've simply heard enough times to accept as the gospel truth. And that's exactly why conversations like today's matter. Because in a world which is overflowing with information, it's more important than ever to listen to voices that are credible. So before we hear from our experts gathered here today, we decided to take the pulse of people at the heart of healthcare itself. Young medical professionals, students, doctors who are witnessing these changes firsthand and in many ways helping shape them. Let's hear what they have to say.
I feel a medical student in India encounters more variety and a huge diversity of diseases in 1 week as compared to any other student in any other country. I'll also say that the selection process is so vigorous and rigorous that only the few students who make it to the top, and also the most dedicated with a lot of resilience and perseverance, those are selected to come into the medical college, and that combined with the high clinical exposure will make the best out of them.
I have recently worked for 3 months in Japan when I was doing my fellowship in hand and upper limb surgery. The technology and the imaging over there is just beyond words. It's admirable. But when I was standing there in a Japanese operation theater, I realized that training in India gave me something that nothing in Japan could give me, my clinical acumen. So handling 15 to 20 surgeries per week over a period of 8 to 10 years has given me something no amount of technology can manufacture. My good clinical instincts. I think that is what sets India apart.
India have so many different kind of things that Western countries will never have. We have so many different kind of diseases that they will read on books, but we will find in every part of our country. That's the main thing, and everything is so cheaply available in India that is not available in Western countries. People think that Western countries have everything available there, but in India we can make anything, but at a cheaper cost.
field, you always have new technology getting introduced, and AI is just one other technology in this spectrum. It has its own advantages, such as it is good at recognizing large amount of data, pattern recognition, but it also has its own drawbacks such as cognitive bias and AI hallucination. So the technology cannot determine what makes a good doctor because it's always in the hands of the user.
Assistant, just how calculator was to mathematicians. Today, at our fingertips, we can do n number of research. We can see so many diagnoses for a disease. We can have so many differentials. We can have so many treatment for a single disease. But what actually makes difference for a doctor who don't know AI and who know AI is how fast he is culminating AI into his practice. Surely, I can tell that a doctor with machine intelligence can replace a doctor who don't have machine intelligence in the future.
Yes, absolutely, because in the last decade or so, what we have seen is that the healthcare in India has really started to become, the cost has started to go down, well as the facilities and the quality has started to go up. At now, particularly, I am from the field of oncology, so I can speak that in oncology, we are competing with the top institutes globally.
And on that note, ladies and gentlemen, let's begin with the simple reality. Healthcare is still in many ways a geographic lottery. Where you're born can influence the medicines that you have access to, the treatment you're going to receive, and sometimes even the outcomes that you can expect. In that landscape, India occupies a unique position. As the world's largest supplier of generic medicines and an increasingly important healthcare destination, India has become a critical player in expanding access to affordable treatment across the globe. But as the industry grows towards a projected $450 billion by 2047, bigger questions emerge. How can India help build global healthcare disparities? How can it bridge them? Can healthcare be both a social good and an economic opportunity? And how do we move from generics to innovation? To explore these questions, may I please invite my colleague Molly Gambhir, who will be taking this conversation forward.
The COVID-19 pandemic marked one of the most difficult chapters in medical history.
The pandemic has once again shown that India's pharma industry is an asset not just for India, but for the entire world.
During the crisis, India emerged as a key global partner, extending help to the world. India supplied medicines and vaccines to more than 150 countries. Indian Pharma not only ensured the global flow of affordable generic drugs, but also strengthened domestic healthcare systems. Today, India stands at the forefront of the global generics market. 60% of the world's tablets and capsules are made in India. The country also operates in more than a third of the US Food and Drug Administration authorized facilities and sells in 200+ countries. Major aid organizations like UNICEF and the Global Fund rely on Indian drug makers for essential medicines and supplies. The Indian pharmaceutical story is not just about producing medicines, it is about driving accessibility, affordability, and delivering hope, both within the country and around the world. It is also about breaking health imperialism and choosing global good over economic good, cementing India's reputation as the pharmacy of the world.
For our panel on India, the world's pharmacy, our esteemed panelists are
Dr. K. Srinath Reddy. Dr. K. Srinath Reddy, a cardiologist and epidemiologist by training, is the founder and former president of the Public Health Foundation of India in New Delhi. Dr. K. Srinath Reddy, a Padma Bhushan awardee, currently serves as an honorary distinguished professor at the institute. Dr. Reddy has played a pioneering role in shaping the public health discourse in India and beyond. Dr. Carlota Alonso. Dr. Carlota Alonso currently serves as the founder and CEO of the European Institute for Healthcare Excellence. She founded the institute to address gaps in quality and transparency in healthcare education. Dr. Shabnam Singh. Dr. Shabnam Singh is a healthcare leader with over 40 years of experience. She is currently the Health Policy Advisor at Confederation of Indian Industries, New Delhi. She is also the founding leader of Max Healthcare Institute.
First of all, a very warm welcome to our esteemed panelists. A round of applause, please, ladies and gentlemen, as we set the stage for this insightful conversation. We've already heard a number of responses from the audience members, of course, to warm up for what lies ahead. It's a very interesting moment that we are standing at today. I just want to first of all delve deeper into this label that India has, known as the pharmacy of the world. Very heavy words, a lot of recognition that India's pharmaceutical industry has achieved. Dr. Singh, if I can start off with your comments on just helping us better understand how rare this combination is that India's pharmaceutical industry really offers in terms of the assured quality and the affordable pricing. Of course, the role that it has played when it comes to the vaccine supply and really championing that cause when it comes to increasing healthcare access as well.
So to your question of how did we arrive at this point?
Yes.
The point of arrival actually comes and stems from 2 points. Number one is the cost of manufacturing, right? And India definitely has an edge and an advantage that the cost of labor, as well as a very, very important part, and that is India excels in reverse engineering, right? We excel in reverse engineering, and also we are able to customize processes very fast. The Achilles heel in this is a mindset of jugaad, and I'll come back to that later.
Jugaad is a very important word here in the Indian ecosystem.
Absolutely. So we have been driven typically by volumes, right? We are able to, in a very short time, bring the volumes to the market at the price point at which the market is ready to absorb it.
Right.
Right? So that immediately pushes you up. So you're able to bring the volume and you're able to give it at the price point. The stickiness comes when it comes to quality. Like everything in life, there will always be outliers. There are always outliers. And unfortunately, what happens when you look at the volumes that you're dealing with, the number of outliers also proportionately go high. So it comes straight into your face that, no, this is not right. Having said that, because you have the volume advantage and you have the price advantage, you have a place in the global stage. I hope that answers your question.
Of course, indeed. And it also helps us better understand how challenging this achievement really has been, because becoming the world's largest supplier of generic medicines, accounting for 20% of the global supply, is no ordinary feat. And of course, it's taken a lot to be able to achieve that. Dr. Reddy, if I can also ask for your comments exactly on the point that Dr. Singh just made, when it comes to the way India has actually been able to tap into its potential, capitalize on its strengths, and also understand the needs of the world, really.
I think the revolution actually began when we moved from product patenting to process patenting.
Right.
That gave us an opportunity to produce a very large number of medicines at low cost. And that satisfied not only our national needs, but then it allowed us to address the needs of many countries across the world at relatively low expense of production and export. And many markets, not just in the low and middle income countries, but even in the more advanced economies of the world, started realizing that generic drugs, which are quality assured, are likely to greatly reduce the healthcare costs in their countries. And that has really given India the label of the pharmacy of the world. Now, of course, there are a lot of new innovations that need to be made. We also need to proceed to innovating new formulations now, not just do reverse engineering. And we are on the way for that as well. I mean, we've just unveiled a new antibiotic, Xenic. So the idea of, which has received WHO recognition.
Yes.
So I think we now have to begin the next part of the journey, consolidating what we have already accomplished, ensuring that we continue to serve the needs of the world while addressing India's prioritized needs, and thereby actually continue to be the global pharmacy with the best of intent and best of performance as well.
Dr. Alonso, I have to get you in here because, you know, a lot of your work extensively talks about this intersection between medical standards and global innovation, which is increasingly important in today's context. And touching upon what Dr. Reddy just mentioned as well, India's role when it comes to also ensuring that public healthcare access is bridged to the extent that it has already done. Your comments first on how you see India's position on that front.
So I see India has a lot of advantages in comparison with other countries because of its expertise and its leadership and also its potential to scale. And I do think that we have to look back to the pandemic. I know everyone talks about the pandemic, but I think we have to reflect because I think the world became aware that we have dependency on the manufacturing centers. And I feel very proud and very honored to be living in India and be part of this ecosystem because people think that people in Western countries tend to think, oh, Europeans are coming to India, or Westerns are coming to India to solve India's problem. And I always say, no, I'm coming to India to learn and to see what I can take to Western countries from India. But living here and seeing India's great potential, there's only one thing that scares me, which is what if we have another pandemic or another similar situation and India struggles? The workforce can struggle. There was an Africa-India summit happening some time back, which was cancelled because of the outbreak in Africa. But I was wondering, what if that was not cancelled, or if that happened a couple days after, and India suffered, and the population suffered, and those manufacturing centers, because the workforce became affected, could not manufacture and deliver to the world. The world would see a bottleneck. So I think that in this respect, India should lead. And maybe from a very naive point of view, establish kind of embassies and consulates from India manufacturing centers across the globe so that we can ensure, as Dr. Reddy was saying, that those processes that that India has innovated in can be replicated in other countries following India's leadership to ensure that in case something happened, we can still ensure the provisions or the supplies of medicines that the world actually needs because we're fully dependent on India.
And that, of course, also stresses on the important role that India has on the global stage. But, of course, the vulnerabilities when we speak of each and every corner of the world is vulnerable. And that, of course, brings us to the immediate concern of how prepared the world really is for a pandemic. We will come to that because, like you rightly mentioned, it's very important to look back at the COVID-19 pandemic and what it really has taught the world at large. But coming back to what we were discussing at the outset, the challenges in bridging the gap, Dr. Singh, when it comes to healthcare access, India's push on that front has been multi-pronged through its initiatives, through its various incentive-based schemes as well. If you can just set the stage for some of us in the audience as well who might not be very well apprised with what India has really done on that front.
Right. So the challenge of healthcare access is not unique to India.
Exactly.
Let me be very honest and upfront about this. 50% of the world does not have access to healthcare.
Yes.
Right? The second part is that we have this notion primarily because our health system, and Sir is here far better equipped to this, from the formation of our Boer Committee in 1942 onwards, the principles of providing care at the primary level, which was emphasized, re-emphasized, unfortunately did not happen, right? And it fell off the wayside. While other countries, and well, they are called as the high economic countries, they focused on primary care. And the tertiary and the quaternary care followed. We simultaneously embarked upon trying to address the primary health care and pushed it down in our federated system to the states, right? So the states were responsible to take care of the primary health care, and the central piece would make the education, the quaternary, the tertiary, etc., etc. So this kind of duality, that is, trying to make sure that the primary works at the same time the tertiary works, kind of brought in that divide of progress on both points. So primary lagged behind, and the tertiary one moved forward. Then around the 90s, right, with the advent of Apollo hospitals in its true form of corporate health care started coming in because the need was so high, you know, and the innovation worldwide, and people did get to know that medicine has moved far beyond others, and there was a lot of what you call brain drain from India going, right? And so our doctors went overseas and would operate on our people who had access to go there. And then the question was, why can't we do it? So then the private sector started hurtling around, right? And that continued moving. So here was this great mishmash. Primary not taken care of, private sector coming into the quaternary, tertiary, and the population increasing. And customer or users, all of us are users, including me, our aspirations also started moving. And let's not forget, you will get a service only if the customer demands it, right? Having said that, Apple is a fantastic example of how you change behavior by bringing a product. But those are far and few in between. And this is very personal. So this mishmash of primary stuck, tertiary moving on its own space, has resulted into where we are. And that is, 2/3 of the country doesn't have true access to good primary care. You know? And it's something that if we do not address, how we are going to address it, if you'd like me to spend a minute and share it with you as to what the change in thought process is, that look, given the population that we have, until people don't answer like you did in the Q&A, right? By being informed, reading, and your own sense of curiosity, how you manage your own lives, we will never be able to address primary health care, i.e., preventive health care is something we have to start investing in now. Personally, I have to be responsible for my health, and thereby I should be taught how to look after myself. And so now, whether it's schools, colleges, corporate world, employers, everybody's getting into the bandwagon of making sure after COVID that you know how to take care of your life. So that is the needle which is going to start changing this paradigm instead of waiting for governments and primary care is never very attractive to the private sector, to change this thing. I'll stop here.
Right, no, of course, and Jaan hai to jahan hai, health as well. We've grown up listening to these phrases, of course, but the need to also increase awareness, like you're saying, and take these issues a lot more seriously. I think the pandemic, again, was a major reminder for us to do that. Dr. Reddy, we have to also touch upon the way in which India has somewhat been relying on global supplies for APIs, the active pharmaceutical ingredients, for example. What are the ways in which India can counter that challenge going forward?
I think COVID brought us the lesson home that we need to be self-reliant, even as we engage with the rest of the world and try and assist global efforts. We cannot fully depend on global supply chains or on global altruism. Now, we saw what has happened to globalization. Globalization came in with evangelical fervor from Western economies, and we had this great statement that the world is flat. Yeah, but even a flat surface can be inclined. It can be tilted in favor of the Western economies. And that's what happened. The moment emerging economies started developing muscle and started growing their economies, then the Western economies started fearing the new entrants, and globalization sort of went off the table. This tidal wave of tariffs and abandonment of Western aid programs merely represents the slash and burn retreat of global capitalism from globalization. Now, that doesn't mean that the world has to be fragmented. It has to be united in its efforts.
An issue like health,
in health, pandemic preparedness, climate change, as you rightly pointed out. However, it's absolutely important that we also develop self-reliance, and in an area like APIs, which you mentioned, where our pharmaceutical industry has to develop medicines at volume and at low cost and with speed for the domestic as well as the international market, we cannot be held hostage by restricted or undependable supply of APIs from China or other countries. We have to develop our capacity for developing APIs within our own country, so that at any given time, if the global supply chains sort of break down, whether for epidemic reasons, pandemic reasons, or political reasons, or whatever, we ought to be able to stand on our 2 feet and produce drugs needed for this country and supply other parts of the world which are also needing it. So I think we should, right from the very beginning of the production chain to the end of it, we should do it. And when I say production chain, I also mean that we should develop the scientific capacity for innovating new medicines all across the line. We cannot depend only on Western knowledge for that. I think we should now move into the next stage of our development from a strong production capacity to a strong innovation capacity as well. We ought to innovate with a lot of new drugs coming in, and we have the capacity to do that. We should be able to do that through academia-industry partnerships, a greater amount of money being put in both by the public and private sector into supporting innovation of new drugs, and possibly advanced market commitments for new drugs that are being developed. There are many things that we ought to do so that we can actually push in innovative new drugs as well. Otherwise, we are going to be left standing behind the global markets.
And speaking of that, what does the world need to do when it comes to bridging the healthcare gaps? Dr. Alonso, you've been working extensively in that regard to bridge some of those gaps. What are the challenges that you've encountered? So what would you say are the immediate priorities when it comes to dealing with that?
So I think the most immediate priority as a user, and reflecting on what both Dr. Reddy and Dr. Singh have you said, for me comes to accessibility. And
billions around the world do not have access to healthcare.
Exactly. But I think thinking locally, even in India, and maybe what I'm going to share is not politically correct to say, but it's a personal example, and I just like sharing on personal experiences. Last month, I wanted to get the dengue vaccine, and I went to an EU embassy, and I got it. But my best friends are Indians, and what I wonder is how easily accessible is the dengue vaccine for them today? And I know this is on the news now, it's going to become easily accessible probably sometime soon. But as of today, it is not. So that makes me reflect how unfair is the situation.
You know, when you speak of that, I can't help but also touch upon this term, which is highly debated, which is medical imperialism, health imperialism. We also touched upon that briefly before the session started. So that, of course, is a term that needs to also be understood and, of course, dealt with. And it's an ongoing fight when it comes to the kind of gaps on multiple fronts. If I can just get in your perspectives, Dr. Alonso and Dr. Singh, on that as well.
So, like Dr. Reddy was saying, the world people don't think the world is flat anymore. We try to establish boundaries and fields and put limitations. And I think because India has the manufacturing capacity, has the innovation capacity, and is also developing one of the strongest digital health policies, I think that should be in our agenda, that we should address how to make this accessible and also patient education, public education in healthcare to everyone. And we were seeing at the initial remarks, we all have social media profiles, and there's this reel going on across all the profiles. Why are doctors becoming influencers? And it's because influencers are trying to play doctors with sharing advice, which is not really useful. And I think India sits at a very advantaged platform because of the digital strength, the manufacturing strengths, and the medical capacities.
Dr. Singh.
So the word imperialism is protectionism, you know. So as it's in your DNA. Every sphere, whether you're a mammal or a human being, everybody is protectionist. Right? This is my turf. Having said that, there are dependencies. If nothing else, COVID taught us about the huge amount of dependencies. Everything that we've spoken about, whether it's logistics chains. As far as healthcare is concerned, there's not a single product, whichever way you skin it, which will remain in the hands of a particular person or a country, right? So a mechanism has to be formed whereby, and this is what, CII was the secretariat for the G20 summit, and we headed the B20, and one of the parts that was taken up was precisely this, that how do you get out for COVID, because COVID experience was very new that time. How do you get out of this that everybody has equitable access to medicines as well as to vaccines? And what is in the methodology in which innovation, as Dr. Reddy said, how do you make sure that everybody is part and parcel about the innovation? Because the R&D spend for a drug is so very high that that protectionism or imperialism becomes even more strong, right? I've spent so much of money, therefore this is my product and I will keep it to me, which then feeds into the patency laws, global patency laws, not only Indian. This has not moved. They're still on the drawing board of who is going to contribute what to ensure that there is a level playing field. So it's a long way happening. It is going to be there. It's very much in our interest to walk the mile with the CDRMOs and the CDMOs and make sure there's self-reliance in our country on the innovation, biosimilars, and onco drugs. It's critical.
Indeed, Dr. Reddy has been wanting to come in. Please go ahead.
Well, just to exemplify what has been said,
yeah.
Look at what's happening to the pandemic treaty.
Yeah.
After the horrific experience that the world has had with COVID, it was resolved at the level of the United Nations and the WHO that we should have a pandemic treaty so that there can be a concerted, consolidated, coordinated response to any future pandemic, from prevention to preparation and response. The pandemic treaty was supposed to have been concluded in May last year, 2025. It is still being debated. Part of it has been approved, but two critical elements are holding back the negotiations and final adoption of the full treaty. One is pathogen sharing, and second is benefit sharing. The Western nations want access to the pathogens unrestricted whenever they're discovered in any country, Africa, India, or wherever, but they don't want to give assurance of benefit sharing for vaccines, drugs, and technologies. There, they want to assert their patent rights. Right. Now, this is a tragedy that we are seeing now, which is holding back the entire treaty, and the United States, having exited the WHO, exited the pandemic treaty, is now negotiating independent bilateral agreements with African countries and some Asian countries for providing aid, including for the AIDS programs, on the condition that they will do pathogen sharing unconditionally. So in a sense, this is, the word imperialism was being mentioned. This is imperialism. Now, if we cannot resist this as a global community, then we are going to continue to see fragmentation, irrespective of all the platitudes that we spout about one world, that no one is safe till everyone is safe. Yeah. We have to bring that spirit of solidarity back.
And like we say, world is one, WION world is one is what we stand for as well. And like you're rightly mentioning, an issue as sensitive and crucial as health is all the more a need for the world to stand united. We are talking about the challenges. Let's also take a moment to look at the opportunities that lie ahead. And Dr. Singh, I have to come to you to talk about, this aspect of medical value travel, which of course is a key element of how India engages with the world. Some very interesting numbers here. The medical tourism market, around $8.7 billion US in 2025, projections of $16.2 billion US by 2030. Of course, India's clinical excellence, its patient-centric approach have been major factors in establishing itself as a major global destination for medical tourism. Your comments on how this can be capitalized further, what would the immediate priority be according to you?
So yes, the opportunity is huge. Are we working on it as a nation, as a country, even from the government's perspective? Yes. There are very ambitious plans of having what we call medical value travel hubs across the country. But again, it all comes down to a place where there are critical elements in which the bilateral part of it has to be sorted out in a very concerted manner. And I'll give you examples. Insurances, people who are insured for treatment in their host country where they are born, those insurances will not cover it for MVT. So that automatically restricts the movement of the individuals. That's point number one. Point number two, transnational legalities have to be sorted out. Right? So if you have a case that has gone bad, now which country, which sovereign country will take up that medical legal case? If you have to go up that value chain, otherwise you'll be doing the small, low-hanging fruit stuff. Then the third bit is that once an individual gets a surgery done, goes back to their parent country, we have to forge a proper alliance with clinicians as well as hospitals on the other end to take care of the patient exactly like the patient would have been taken care of by us. Right. So the continuum of care has to be embedded in this MVT story. Once we are able to tick these reasonably, then we can definitely actualize the numbers that you said.
Very interesting. Dr. Reddy, closing remarks from you, please. We're completely running out of time. I would love to go on. But if I can just ask you to comment on that and just share your thoughts.
Well, we do need to ensure that our health system has the capacity to deliver for the entire country, meeting our own needs first. At the same time, extend facilities for those who want to take advantage of India's skills and economic affordability to access healthcare here. So I think we ought to really strengthen our health systems tremendously in order to meet both domestic and international demand. But in that, I would like to make one parting comment.
Sure.
The whole world is short of health workers. The WHO says till 2030, the world will be short of 11 million health workers. India too will require many more health workers. If we really want to invoke the spirit of global solidarity, we need co-investments in production of health workers, so that particularly countries which have young demographic profile, like South Asia, India in particular, and Africa, which have young people who can be trained and can be available for the global market. For that, the whole world will have to co-invest.
Right.
That's an important element that we need to address.
Very well summarized. I would say, Dr. Reddy, Dr. Alonso, Dr. Singh, thank you very much for being here, your insightful comments, perspectives, and really taking this conversation forward and the need to have more of such conversations. Thank you very much for your precious time. Thank you.
Thank you.
May I please request Molly to felicitate our guests? Thank you so much, Molly, and to all our panelists for sharing your astute insights with us. You've definitely given us a lot to think about. But before we, start the next session, how about we bring Dharamjot and Nikita back for another round of myth busting? And since most of you got all the answers right in the previous one, how about we take it a notch up? Dharamjot and Nikita, over to you guys.
Thank you so much, Diksha. Well, we are back with a couple of questions again. And given how everyone answered it the first time, I have really high hopes again this time around. So very quickly, the first question again, myth or reality? Cold weather is what gives you a cold. Myth or reality?
Yes, ma'am.
That's actually a very, very easy one, Dharamjot. Cold weather doesn't give you cold, for sure, because it is linked with virus. And fortunately or unfortunately, it is still untreated. It still doesn't have a treatment, and probably a common person also would know that even if we don't treat it for a few days, it might just go away. So that's what I understand about it. I am Professor Mahima Kaushik. I am from Delhi University. And I am not a person from medical background, but yes, we do a lot of research, as I have BTech students who are in IT and mathematics. So we deal with a lot of data analysis, machine learning, artificial intelligence, and a lot of nanobiotechnology. That's the reason I'm here, so that I get to hear more and more about the health and the related issues. So thank you so much.
Thank you so much. In fact, the way you told me that it's a myth, Dharamjot, took me right back to high school, where my teachers would pull me up the same way. So I should have guessed that you're an education expert. But moving on, Nikita, next question.
Thank you for that lovely answer, ma'am. Moving on.
Oh, we have a memento first. Sorry.
Of course.
Before we move ahead.
Thank you.
A round of applause. Thank you so much. Go ahead.
All right. This is a common, health claim that we deal with on an everyday basis in our households. Coconut oil is one of the healthiest oils for everyday cooking. Any kitchen experts in the audience? Yes.
So I use coconut oil every day. It's my primary oil, go-to oil. But I just want to clarify that it has a very high smoke point, so it's not good for frying. But you can use it for saute and etc. etc. But it is, personally speaking from my own experience, I can really swear by coconut oil. I use it across all seasons. So it's not about it generating heat in the body, etc. And I personally feel that it's a really healthy alternative, even to olive oil or to other whatever oils. And also I use cold pressed. So I think the cold pressed coconut oil, you can also have it raw.
Right.
It's very tasty, and I think it is the healthiest, one of the healthiest alternatives.
Sure, thank you for that answer, ma'am. Though coconut oil actually contains some high levels of saturated fat, and certain alternatives to cooking oils at home could be olive oil, which has high levels of unsaturated fats, which is better for your health. But thank you for that answer and for your insights.
Can we have a quick memento for ma'am, please? It's wonderful to have such personal experiences and insights being shared by everyone who's present over here. So thank you for that. Okay, question number 3. Again, a personal favorite. Chocolate causes acne. Is it truth or is it myth? Would you like to answer that, sir? I did see you. Yeah.
Chocolate is good for the mood and etc. So I don't think this is correlated, and in my opinion, it's a myth.
Well, you're quite close. Yes, it is a myth. I think also the details lie in the fact that it should be good quality chocolate. Darker chocolate is definitely good for health.
Of course.
Sugar is what usually a lot of skin specialists say that maybe somebody with acne should avoid to try and test if it shows a positive reflection on their skin. But yeah, that is
excess
the
of
correct
anything is bad, so excess of chocolate is also bad.
Absolutely, absolutely. Thank you so much for that answer. A round of applause for sir, please.
Thank you. And well, that's a wrap on this very insightful discussion. We'll be back, hopefully, with certain interesting questions, because certainly we do have a very engaging audience and would love to engage with you. Back to you, Diksha. Thanks.
Thanks.
Thank you so much, Dharamjot and Nikita, for keeping our audiences on our toes. But now, before we move into our next session, let's also listen to some budding health practitioners and professionals across India and see what they have to say.
In my opinion, both are equally difficult, but the state at which we face, it's completely different. Getting into medical school is not just competing with a number of 30 or 35 like in school. It's about competing with about lakhs of students around the country. So you need to, compete with them, get the score, get into medical college. But that doesn't end there. Once you're into the medical college, you need to kind of gain your knowledge, improve yourself, stay updated, deal with patients, their diagnosis, their treatment course, and a lot more. This is just more professional side. On personal side, dealing with staying away from your family, dealing with your surroundings, your friends, your health. So it comes as a whole lot of package.
Honestly, the answer to this is tricky. It can be both because it depends entirely on how the doctor uses it. I use AI in order to do my quick research or get a good literature review. I use it as a well-read assistant. The problem comes when many of my younger colleagues are looking at it in the view to get an algorithm to manage the patients with that. So all these years of my clinical practice has taught me that I have to look at the patient, feel and examine first before looking at any AI.
opinion, getting into medical school is way tougher than surviving in medical school. It's actually a difference in perception. So if you think about it, getting into medical school, we are faced with it when we are in the school. So we are still in school and we're faced with the pressure of NEET, and it's a competitive exam, and there's coaching centers, and there's so many mock tests and scoring and ranking, and they show you how you stand, where you stand, and even spite, like for me, I was taking a test in the morning, one mock exam in the morning for 3 hours, one mock exam in the evening for 3 hours, then they'll have the correction session, and still our scores will be so low, we'll be like, oh my god, it's going to be so stressful. And the worst part of it is the uncertainty. You don't even know in what direction this is going. Are you going to end up in medical school? Are you going to end up pursuing the medical education? Or are you going to end up in some other profession even though you really want to do this?
AI is going to help doctors. It's not going to replace the doctors, because every patient needs a human touch. Every patient needs someone who they can talk. Like I am doing radiation oncology. Every patient needs emotion. They have to share their emotions. We have to talk. They have to tell them that they are going to get cured. Treatment is there, but AI is not going to do that. But AI is going to help us to do better treatment.
Doctor or a medical student, if they use the AI tool uncritically, then they become entirely dependent on it. So a good doctor must always rely on their own independent thinking as well as critical decision making skills, while using AI just as a tool to aid in the same. So to answer your question, yes, AI does create a better doctor, but only when the doctor completely relies on their knowledge and uses AI to enhance the existing knowledge, which aids in decision making.
So if you had asked me this question 10 years ago, I would tell getting into medical school was a tougher one, because one studied day in, day out for the exam. But if you're asking me after a decade, I tell that surviving is one whole transformation, because it's about patience, it's about knowledge, it's about giving in everything, it's about resilience, it's about empathy. So if I tell getting in is an exam, the whole journey is a sheer pure transformation.
So basically, getting into medical school tests your ability to read, to memorize the things, the academic excellence. But surviving it basically tests your emotional abilities, your psychological abilities. Because every day you have to deal with not just the health of the patients, which is ill, but also the death of the patient.
Our next session turns to a subject that has moved from margins to the mainstream in just a few years. Not long ago, conversations around mental health, they were wrapped in stigma and silence. Today, the frequency and the fluency with which we talk about depression, anxiety, OCD, PTSD, burnout, it's undoubtedly progress, but we've also in the process somehow diluted the nuance and sensitivity with which these issues need to be addressed. Confiding in AI chatbots, exposing our vulnerabilities in digital spaces which are designed to feed off of them. Where exactly is the gap? And how do we encourage vulnerability without trivializing genuine distress? And are our support systems keeping pace with the pressure of modern life? Well, my colleague Shreya Upadhyay will explore these questions with our stellar panel. Over to you, Shreya.
Have you ever woken up feeling drained, dazed, and discouraged, unable to focus or pinpoint the cause? It's not always as obvious as a physical ailment. More often, the psychological load is hidden, but too demanding to ignore. mental health is a crucial part of overall well-being. According to recent studies, nearly half of young adults worldwide face mental health challenges, frequently linked to smartphone use, ultra-processed diets, and a lack of real social connections. Despite this, mental health remains one of the most overlooked aspects of our daily conversations. Raising awareness in support of mental health is key to addressing the issue. And seeking help is not a sign of weakness, but the first step towards healing. When we open up and seek support, we not only protect our mental well-being, but also create a healthier environment for ourselves, our families, and our community. So keep turning inwards and check in with yourself with one simple question: how am I doing right now? Your honest answer might be the signal you need to relax. Hit the reset button or seek professional help. For our panel on mental health, the invisible pandemic, we are joined by Dr. Rajinder K. Damija. Dr. Rajinder K. Damija is a distinguished neurologist and an academician. He currently serves as the Director and Professor of Neurology at the Institute of Human Behavior and Allied Sciences, New Delhi. He has over 3 decades of experience leading pioneering research in neurology, especially in stroke and movement disorders. Dr. Jitendra Nagpal. Dr. Jitendra Nagpal has over 30 years of experience in the field of mental health, with a special focus on the psychological well-being of children, adolescents, and women. Dr. Nagpal currently serves as Senior Consultant Psychiatrist at Mulchand Med City in New Delhi and is in charge of mental health and life skills promotion at the same institution.
Hello, good morning everybody. I'm so glad that we're talking about mental health with a group that has all age groups because it's relatable, it's very, very regular in our daily lives, not just when there's a mental health crisis, but in general, just to have a happy state of mind is something that we all have been talking about, but perhaps don't really identify when we're in the situation, when we're in the crisis. And therefore, my question to start this very interesting and intriguing session, Dr. Damija and Dr. Nagpal, is the fact that what really is mental health crisis? When do you know? Because I'll tell you why I'm asking you this. I believe there are 3 segments, 3 groups in our society that talk about mental health. The one is the older generation who say, अरे तुम लोग को नहीं पता है, हर बात पे तुम लोग stress ले लेते हो, क्या है ये labels लगा देते हो. Then there's an age group which is mine, who's unsure. They know कि कुछ चल रहा है, but they don't know what to do, or maybe they don't have the time to go to a therapist, a psychiatrist, a psychologist. Then there's Gen Z, the younger ones, who are openly talking about it, who are not shying away from going to a therapist. So when you have such varied age groups with such varied understanding and perception of mental health, where do we stand? What is mental health crisis, and how do we identify? At what point do we know we're going through a crisis? Dr. Damija.
Good afternoon, everyone, and thanks for having me and Dr. Nagpal and having mental health at the forefront of this conclave. You rightly said that it's an invisible pandemic, and recently the Supreme Court of India, when they were constituting a national task force on mental health, called it an epidemic. And this is something which we need to understand, that we are exposed to so many of factors, including environmental, including social, including economic, including medical, including financial. And these are coming up from all fields. And we are all exposed to this from the infancy to the first, let's say, 1,000 days to the last 1,000 days, all age groups. In the era of digital era, we are bombarded with information all around. And that is, again, causing a reactive and a kind of a response to this all information all the way. In addition that there are basic mental health disorders. We all have numbers in India, whether it is National Mental Health Survey, the current being already ongoing from National Institute of Mental Health and the Mental Health and Neurological Sciences, Bangalore, and from IBHAS and from AIMS, Delhi. So where I come from, Institute of Human Behavior and Life Sciences is one of the largest mental health institution in Asia. So we are the largest neuropsychiatric hospital, and we have more than 3,000 people coming every day in our outpatient clinic. So you can see the numbers. That is one hospital, and the numbers are quite high. People need to understand there is a need for mental health interventions, but there is less demand. So we need to create that demand. We all understand there is a problem, but how many people come forward to seek the professional help? So that is where we are lagging behind, and that's the stigma, that's the mental health literacy, where we can work upon, and conclave like this are very important in creating awareness amongst the masses so that people can come forward and seek professional help.
Dr. Nagpal, the same question to you. And in fact, I want to understand from you whether mental health crisis has been rising over the years, or we're just becoming more aware. It was always there, but now we're becoming more aware and we know what each situation, each crisis is called.
Thank you. Thank you, all of you. I think, first of all, it's intriguing that such a topic is being taken up on a multifactorial and also multidisciplinary forum. Two aspects come to my mind, taking the clue from what Dr. Dhamija mentioned. One, mind as a component of day-to-day health has often been ignored, neglected, and condemned as you grow up in a stereotyped, stigmatized society. Second, mind as a complement to physical health and not competitive to it. Two factors have influenced the acceptance of mental health in a culture which has 3,000 years of mental health capacity building. The Indian knowledge systems, the Panchakoshas, the Varunas, and the Doshas. So that's one point. Second, what brings us closer to an invisible pandemic? India accepting it. India accepting it without stigma, with awareness, with professionals coming up in a big way now. The reason is, we also believed in about 25 years, the new millennium now, that non-communicable problems, non-communicable disorders, जो हम पहले सोचते थे कि Western concept है, hypertension, obesity, diabetes, cancer, drug abuse, depression, what else? Road traffic accidents. When the data came in, and we were destined to be one of the capitals in the world for all these, you go and see the data now. Obesity, we are a pandemic. Cardiovascular disease, we are a pandemic. Then I think our thinkers, our policymakers have also realized they are all, majority of them are human behavior related. You won't find many of them in rural settings. The urban India pandemic is also non-communicable disorders in which mental health is leading now. Because my obesity, my cardiovascular, my cerebrovascular, my dietary patterns, we heard 3 questions just now, is influenced by the way I think, feel and behave. If mind and mental health was in the dock, in the storehouse of the policy, one reason was that we had to struggle with survival with communicable disorders in our country. We spoke about dengue, we spoke about chikungunya, COVID. We survived, we thrived, we are happy. But now let us look into mental health because it cannot be ignored anymore. We are leaders in the world in terms of human resource. Tell me, where else in the world you have 1.4 billion people and at least about 60 crores of young people beginning to be leaders for movements like mental health, for gender? It's in India. The tragedy was that we were not having mind and mental health as a component of day-to-day life. And the 3 reasons given in most of the research in India was stigma, stereotypes, ke ye to pagal hai. Condemned, denied, ostracized and neglected. Second, lack of awareness, jaisa maine aapko bata diya. Third part being very important, what sir said, lack of professionals. Where were the professionals? A country that has a 3/4 psychiatrist, not even one, a 3/4 psychiatrist for 1 lakh population, and the world average required by WHO is 3. It will take us years. Second, a total number under the Indian Psychiatric Society and the clinical psychologist available to understand, treat, manage, recover these people who suffer unnecessarily because of mental health disorders are just about 15,000 people. And we need about 5 lakhs of them. So now, post-COVID, it became a visible pandemic, lasting more than COVID. So now I think the government has taken up seriously. The Prime Minister talks about in Pariksha Pe Charcha and Man Ki Baat, how mind and components like mental health influence us. So these are my preliminary comments, I thought.
You know, I'd love for my parents to listen to you, Dr. Nagpal, because at some point in life, I wanted to become a psychologist and they were very hesitant. So, you know, I completely relate to what you're saying, that there has been a hesitancy in sort of letting your kids and letting your family members and loved ones go into that field. But Dr. Dhamija, since you so closely work with students, with youngsters, you're associated with UGC, you're also part of the Supreme Court appointed National Task Force for Mental Health. What is it in youngsters and students that is leading them to a mental health crisis? Is it just the digital era that we are living in? Or is it also a generation gap that we as adults are not able to understand what they're going through? We haven't sort of, filled that gap for them.
So I think there's multiple factors. They're all combined together. Recent data shows that there has been 80% increase in the suicides in students over last 10 years, 11 years. In fact, if you go through the numbers again, many of the educational institutions do not have the mental health care access. Even the 50% of the institutions, universities, institutions of higher learning did not have sensitization of their faculty in last 18 months when the Supreme Court mandated task force was preparing the report and interacting with the faculty, students and all the stakeholders. So these are very, very alarming numbers, and of course, there has been a lot of work being done now. The University Grant Commission has come up with, it's coming up with the guidelines. I'm the chairperson, Dr. Nagpal is also working with us as a member. So we are coming up with the guidelines for all the universities in India to work on mental health, to create an ecosystem in the universities or institutions of higher learning which are mental health friendly for the students. I'll share our own experience from IVHAS in Delhi. So we adopted 30 government schools a couple of years back, where we provided the counselors, we provided the screening of the students, we interacted with the teachers and the parents. So, and of course the professional help if required in the hospital. So our experience was that even the parents and the teachers, both were resistant. They would not like to talk about the mental health issues, the barriers. So we came up with the report, the barrier and challenges of school mental health initiative, what we call them. And it was very difficult to convince them that this child needs help, or he has anxiety, or he's facing bullying, or he's facing the other anxiety problems, or with the competitive. So I think there are many factors, whether it is the institutions, or it is the parents, or it is the academic pressure, or it is the ecosystem, or it is the digital era. So there's something which needs to be done at all levels, and I think the government has taken initiatives, but it's also important to civil society to take up this.
Yes, and that is why I think mainstream conversation about mental health is extremely crucial, and that is why we're having this conversation. Dr. Nagpal, perhaps in the last few years, we would have said that, look, people who are from underprivileged background or people who are going through some sort of difficulty in life, they are the ones who go through mental health problems. But that is not true today. Now we know better. We know that people from well-to-do families also suffer through mental health crises. That sort of myth has busted, right? Do you see that when when you're meeting with people? How often does it happen, that entire gap having been completely closed now between the rural and the urban?
Needless to say, thank you for picking up this question. I think we are here with the thinkers of the country, and I'm sure, I was just talking to Sir also, the divide is huge. It's a gorge. Urban mental health crisis and rural mental health scenario, I would call it. It's a scenario there. It's a crisis here. 15 to 45 years, आपने बड़ों की बात करी, बुजुर्गों की बात करी, they are happier, healthier, smarter. I see by the average. Today morning I've seen 2 students. One from a Delhi college and one, of course, still preparing for the NEET exam which got postponed. Doesn't want to give up. Parents don't want to give up, the child wants to give up. Now why? The question is competitiveness, pressure, fantasized pressure, the power of packages and placements in life, and also the cutthroat survival in the apex institutions of urban setting. You tell me by your wild guess, what are the number of suicides in the IITs of India? Anybody? Just Google it. Only 25, 26 IITs. The best institutions in the world we have. One, because the emotional intelligence is never seen for the last 25 years as equally competitive and complement to the IQ. Highest IQ kids of our country have the highest rates of suicides. Why? Don't we have to answer it for our younger generation? Otherwise they'll turn around and say at Viksit Bharat time, this is the world you gave me. Parental pressure, I'm sure you didn't have that. Parental pressure, survival, otherwise get out. That is a feeling a child has in urban India, not generalizing. The ones which we see, I'm sure sir also comes across. So my question remains, to tell you very honestly, helpless ho jate hain, because we were not prepared for this crisis. 16-year-old takes an appointment and says, okay, I say, mom or dad, anybody can come along? Doc, why do you want my parents? I'm taking an appointment. I don't think they're worthy of coming along with me. What do I do? So that's urban India. Let's be prepared. Let's accept it gracefully and generously also, because the young India is wanting mental health to be discussed as a platform. I was telling you, sir, we have the Mind Smart program. It is in higher education. It is in school education. More than 10,000 schools have benefited. There are peer ambassadors of mental health. Life skills is a terminology for school education now. So India is very progressive. But your question is answered in one line, that urban India has a mental health crisis. One, because the loneliness epidemic is in urban India. Let's check out. WHO has brought in the terminology of loneliness as being the invisible epidemic, depression being the visible epidemic. Uska manifestation jo hai. Hum bheed mein hai, lekin itne akele hain. Talking at home, chatting at home, conversations at home, zero. Teenagers grow up in a lonely environment. Many people you must be knowing. They grow up in an environment where they are latchkey children, double income, no kids, wo bhi fashion hai, and also having maybe kids where they want to help parents do good parenting. That's urban India. There's so many people who come to us and say that, yes, can I run a campaign? I'm talking about teenagers, about good parenting for my own parents. So I think it's a beautiful opportunity for human resource in India to minimize the urban mental health crisis. And I think worthwhile to share a data over here. 11 out of 100 Indians are at the moment in need of tertiary mental health care intervention, yani ke diagnosable hain. And 14 years is the peak point of, remember, teenagers. 14 years out of whatever may be our life expectancy, say 80 plus, is the peak point in India where mental health conditions are showing the flag signs and the warning signs.
Okay, Dr. Dhamija, you wanted to add?
No, I'm just continuing with Dr. Nagpal said. A couple of years ago, we were at IIT Gandhinagar, both of us, sent by the Government of India, the Ministry of Higher Education. And we had this 2-day workshop for all the directors of IITs in the country, deans and directors. The day we were discussing how to create the ecosystem in IITs, same day, the suicide happens in IIT Delhi. Same day. So you can imagine the people, the high caliber competitive students coming to IIT and finding everybody over the same level. And then you have to come out of that, see that this is something which we have to struggle and survive. So the individual pandemic is not only at the periphery level, it is at all levels. We deal with many elite schools in Delhi also, the elitiest of school. And in those schools also, there is a EWS category, there is other category. And we find equal number of issues, whether it is bullying or it is anxiety or it is peer pressure or it is apathy. The apathy of the students, apathy of the teachers, apathy of the parents. The lack of redressal mechanism at the schools. All these things are contributing to the rising number of the suicides in the students, whether it is Kota or it is somewhere else. So we are struggling to come out of this, and I'm glad that the government is taking the steps, but at the same time, a conclave like this is very important to bring out that awareness, that campaigning, that this is something which we need to talk about. It's okay not to be okay.
Yeah, absolutely. It's
That is
okay
very
not to be
important to
okay.
see.
Yeah, and I think it's very crucial for all of us to believe in it. Before I take this conversation forward, we have a message from the Health Minister of Bhutan. Let's listen in. Remember, Bhutan has been topping the happiness index. We all can learn something
GNP.
from them. Let's quickly listen to that.
Namaskar. I am delighted to join World is One, WION, and would like to extend my warm greetings to viewers across India and beyond. Today, I would like to share Bhutan's health sector journey, the progress we have made in improving the health of our people, and the invaluable contribution of Bhutan-India cooperation in advancing our shared goals of health, well-being, and sustainable development. Health has always been a national priority in Bhutan, guided by our visionary monarchs and enshrined in our constitution. Bhutan's healthcare system is founded on principle of universal access. Every citizen is entitled to free healthcare services, including both modern and traditional medicine. This strong foundation has enabled Bhutan to make significant progress over the years. We have achieved notable improvements in maternal and child health, maintained high immunization coverage, and successfully controlled many infectious diseases. Like many countries, however, Bhutan faces emerging health challenges. We are experiencing growing demand for specialized healthcare services, attrition of skilled health professionals, infrastructure gaps, and rising burden of non-communicable diseases. To address these challenges, Bhutan has embarked on important health sector reforms since 2023, focusing on strengthening governance, improving primary health care, promoting innovation, strengthening medical education. Our primary objective is to ensure that quality health care remains accessible, equitable, and sustainable for future generations. Throughout this journey, India has remained Bhutan's closest and most trusted.
Dr. Nagpal, what can we learn from Bhutan?
I'm so happy that Sir also mentioned about the non-communicable disorders, and right now in the panel we are discussing mental health, which is a leading non-communicable disorder in the world today. One, because it is largely invisible. Secondly, it has a manifestation both as an isolated mental health problem and very largely as a manifestation of our physical disorders also, isn't it? And it's heartening to see robust policies coming up in India now. I'm very happy to see that partnerships are evolving in the education sector, social justice sector, and women and child development. The three ministries directly working with the health ministry. Education, Sir has already mentioned. India boasts about 16 lakh schools, little bit more than children in Switzerland, I believe. 5.2 lakh schools are only higher secondary, that means +2. Can you imagine the great human resource of young leaders to transform the perception about mind and mental health? And that is happening. The school mental health policy is likely to come in. University mental health policy, both of us are there in it. Iska matlab kya hai? Every institution has a role to play in promoting well-being of an individual and groups who study there. Because these are the people who will matter 30 years from now. The students who come out, they will be part of the business world, the policies, and the media world also. But the ones who are already into the gamut of 11 to 14% of disorders, I think at the moment very much important is destigmatize, demystify. Destigmatize and demystify the mind. ये mysterious नहीं है. ये heart, lung, किडनी और लिवर जैसा ही है, except that it also can think, feel and behave, unlike liver and kidneys. It can think, feel and behave. So उसको mental health कहते हैं, brain का part जो है. Why can't we give it more importance for those people who are already suffering, like you said, ma'am, the elderly people, neglected, condemned, sometimes ignored in the society. I believe we are the largest, in short years, few years, we are the largest geriatric population in the world. Young तो हैं ही हम सबसे ज़्यादा. इनका क्या होगा? How many of you come across requests for addresses of old age homes? I come across every week. You go from Delhi to Jaipur, look at the number of old age homes, luxury homes coming up. Fine, जहाँ needed है, neglected है, अकेले हैं, ज़रूर जाइए वहाँ पे. But I come across families, ma'am, who have got 10 members, mansions to live. They still want old age home for their parents and grandparents. Where are we as India? We are supposed to be the great Indian family system. So children are the change makers. I've come across youngsters telling me, no, I don't want grandpa to go to an old age home. I'll take care. नानू दादू मेरे साथ रहेंगे दोनों. कितना अच्छा लगता है. I thought they are the ones who will change the world. Let's give them the Rajdoots, the ambassadors for tomorrow. So that's what the MindSmart program does. So people who are already suffering, ensure that they reach out to help. Help available है, कम नहीं है. But hospitals कहाँ जाना, किसके साथ जाना, कौन लेके जाएगा? At times, family members need to have time to take somebody to a psychiatrist or a psychologist, no? They can go to a cardiologist, they can get a stenting done, they can get a liver transplant. But what about depression? कोई organ बचेगा नहीं ना अगर वो suicide कर ले तो. क्या फ़ायदा होगा? I'm only looking at those people who are already suffering. So I said demystify and de-stigmatize the mind. Third part, very important, decentralize the services, which the government is doing flamboyantly. Primary health care is coming up in a big way, and we are very happy that the general duty medical officers, the MBBS curriculum today, the Anganwadi workers, the ASHA workers who reach out for immunization in the villages, they have modules on mental health now. Isn't it, sir?
Yeah.
They have modules on mental health. And that means we are a very fast-moving country. We have problems, no doubt. We have 1.5 billion, which is going to be now in the next year census. But I think thinkers like all of you, with more and more platforms to discuss, to aggressively come forward, the corporate social responsibility for mental health has to come in huge, billions. Have you read the WHO's report? $1 trillion is the global burden of economic loss because of mental health world over. And today, the Indian Economic Survey has come. Today means just a few weeks back. I think some of you may be knowing it. They say that absenteeism, there is something called presentism also. I'm present but not present in the office, not working, because I'm suffering something wrong in my head. So presentism, absenteeism, inadequate work, either from home, and decline in my overall productivity in life is what Indian Economic Survey says is mental health suffering in the workplace. So let's help our colleagues, our friends in the workplace also. So if Economic Survey can do it, the happiness index can do it in Bhutan, why are we waiting for making mental health conversations a family time, a work time, a lounge time in the office, in the schools, in the universities, and in even places where angels fear to tread, even in asylums. There are no asylums, no word called asylum anymore, it is stigmatized. But mental health hospitals से दूर से निकल जाते हैं. हम क्यों? Because हमने उसको एक हवा बनाया हुआ है. So I think these are the cultures we need to develop. The government is doing it. I'm sure sir has more to add to the culture of accepting mind as a societal phenomenon, not as a boardroom phenomenon or in the hospitals.
Dr. Dhamija?
No, you are absolutely right. In a hospital like ours, लोग आधा किलोमीटर दूर गाड़ी खड़ी करके आते हैं कि कोई देख तो नहीं लेगा कि मेंटल हॉस्पिटल में क्यों जा रहे हैं. So the hospital which used to be called as Mental Hospital Chadra is now Institute of Human Behavior and Allied Sciences by the Supreme Court order that you will remove the mental health word from this. So I think these kind of initiatives are very important for destigmatization and something like this. But I'll tell you something more about what Dr. Nagpal was alluding to. So India has now more than 180,000 Ayushman Arogya Mandirs. And we have developed modules called MNS, Mental Health, Neurological and Substance Abuse. Every CHO, community health officer, or the the people who work at the Ayushman Arogya Mandir, CHCs or PHCs, two different kinds of AAMs are there. So they are now trained to pick up red flags if somebody has at risk of developing severe mental disorder or neurological disorder or substance use. So now the bottoms-up approach is coming up, that we are fishing at the bottom, at the Ayushman Arogya Mandirs, where the patients can be referred to the appropriate level, whether it is district hospital or it is in the tertiary care centers. Now coming to the what has been done, is we all talk about there's a problem, there's a problem, there's a problem. But we are also doing a lot of things on this aspect. If you see the recent budget, I wrote in Hindustan Times, the opinion editorial, this is the first time in the history that the budget had so much of emphasis on mental health. The budget paragraph 87 and 89 and 90 clearly states that we need to have a NIMHANS 2 in the northern India. So NIMHANS is in Bangalore, is a big mental health brand, which recently got WHO award also. So north of India, we don't have any such tertiary care, the world leader in the mental health. So we are going to have the NIMHANS 2 in the northern India, hopefully in Delhi or somewhere nearby. So that is the first time the union budget has come up with these things. Not only this, they are upgrading the central mental health institutions in Ranchi and Tezpur. India has around 45, 46 mental hospitals also, including Amritsar, Agra, Gwalior, Bareilly, all these things. So they are being upgraded. They are also increasing the budget for the manpower development, for creating center of excellence in different medical colleges and hospitals. They are also investing in the district hospitals. The Niti Aayog has come up with the National Task Force on Brain Health, which I am the chairperson. And we have started in 12 districts of India, 2 in north, 2 in south, 2 in east, and 2 in west, and 2 in central part of the country, where we have district brain health centers, including the mental health, which is being manned by psychiatrists or a neurologist. So this is a pilot project which the Niti Aayog has given 1 crore from the government of India to each center. So if this pilot becomes successful, this will be rolled out in 760 districts of the country, which will be huge step to create mental health ecosystem and the services which would be accessible, available, affordable, and adaptable to society.
You know, we've got a message from the Honorable President of Guyana. We'll play that out, but before that, I want to ask both of you how much of this impacts. Dr. Nagpal, you said that there's a fashion of having double income and no children, and there's loneliness, and people want to, they're aspiring higher and higher for themselves professionally. And India is an aspiring country. It's an aspiring economy. We've had a history of colonialism. We got our freedom, and now people want their standard of living to increase. In that scenario, how do you then, tell them that, look, aspiration is one thing, but you have to balance out your mental health as well? Because, there will be people who say that, look, we want to enjoy what we earn. We don't want to be limited to responsibilities of life.
What a philosophical question, actually. Wonderful. The time to decode, I'm sure some of the learned audience will have answers to this. Only yesterday, we were having an online meeting with some school principals, and children are asking these questions, jo aap pooch rahe hain. Can you tell me the difference between happiness and success? Can you tell me what is materialistic success and what is emotional success? That means the doubts are coming to young ones also. It's not about you and me and all of us here. Aspirations will remain, but aspirations for what? Agreed, financial literacy and financial backup is the most important survival mechanism, even if I'm aspiring to be in the best of the institutions and best of the jobs. But what is happening, and evidence has come for that. Evidence is happening that while we are skyrocketing into, I would say, target, attainment-oriented, achievement-oriented life, targeted to achievement and attainment-oriented, which is fine, needed. One cannot, wait for basic finances and talk of happiness, right? We are not yet Bhutan. But on the other hand, the fallout, the tangential fallout has been simultaneously in the urban world, the pandemics of loneliness coming in. There is enough data India can boast now. I'm very happy you mentioned, ma'am, colonialism से बाहर आ गए हैं. हम वेस्टर्न डेटा के लिए नहीं वेट करते हैं हमें समझाने के लिए कि हमें क्या करना है. We have our own data now. NCRB survey, NCRT survey, NMHS survey, ICMR survey, economic survey. 5 fantastic Government of India surveys telling us कि mental health के लिए कुछ करना है. करना ये है that हम जो भी aspirations हैं उसको साथ लेके चलें. If I'm competitive to earn a given amount or maybe get a placement after IIT, IIM into Microsoft, Apple, Adobe, anywhere in the world, simultaneously, can I be enlightened or get myself enlightened about personal, family, social, physical, and my own mental health? So this remains a question because it has its own answers. We see, the answer was in the previous question you asked us, the fallout on non-communicable disorders is highest in the urban India then. So-called most successful, highest educated India, having the highest amount of non-communicable disorders including mental health. क्या ये paradox acceptable है हमें? It's an irony, no? I'm the most successful CEO of the country. But I yesterday had a stenting with 2 stents, right? My teenager doesn't want to remain with me. My wife is waiting for me throughout. Whatever may be. I'm just telling you anecdotes which come every day to all of us and papers also. So it is, this answer may not come only from me. But I'm so gradually turning into a social psychiatrist because I'm realizing कि ivory towers में हम भी नहीं काम कर सकते अब. Verticals में बैठ के खाली जो हमें सिखाया गया था 10 साल की एजुकेशन में कि diagnose करो, दवा दो, counseling करो और छोड़ दो. I'm sorry. I don't think I'm made for that. I'm made for helping families to understand that let's go beyond conventional therapy. And therapy is, I insist, by a norm, which I think, Professor, we have discussed a lot together whenever we've gone. I have watched out for a pillar in the family when they're all sitting in front of me. एक खंबा चाहिए जो पूरी परिवार को रोक सके बिखरने से. और वो कामयाब होता है. Otherwise I go very helpless. कि भाई समझ नहीं आ रहा, आप लोग सारे परेशान हैं, सारे गिरे हुए हैं, सारे एक तो चलो ताऊ मामू चाचू किसी बंधु को लेके आओ. And believe me, we have plenty of such people in our families. And let's not copy the West because मुसीबत के टाइम पे it is in India only that अस्पताल में भी 50 लोग खड़े हो जाएंगे. बाहर कहीं नहीं होता है. Families नहीं आती हैं. So why first aiders cannot be? First aiders in mental health are relatives, friends, colleagues. First aiders क्यों नहीं तैयार हो रहे हैं? Second part, what you were asking, the financial race, the best answer has come from IITians. They are the brilliant people. I was in IIT Bombay, sir was in IIT Gandhinagar with me, and we went to IIT Ropar, we went to IIT Kanpur. Everywhere the conversations are with the most brilliant young people in the country. And what you know what they're saying? We wish to talk about well-being, but we are pushed, pressured to the idea of getting the best jobs in the world. But their heart still lies in these conversations. हम उनको छीन रहे हैं वहाँ से. And that is what they repent later. Haven't you come across so many cases of self-shooting in California? Indians, so many of them, best placed people in the Silicon Valley. My own cousins who are there, वो मेरे से सलाह लेते हैं रात को. हम depressed feel कर रहे हैं. मैं बोला वापस आ जाओ. Money is not a problem there, no? Here also. So I think this is a question which you asked, very relevant, not only for Dr. Nagpal, I'm sure. This is for all of us to answer as India's future. Because our children will ask this question when they grow up in 2047, with Prime Minister says, Viksit Bharat, कि सिर्फ मुझे जॉब के लिए तैयार किया था आपने, सिर्फ काम के लिए तैयार किया था, लाइफ के लिए तो तैयार किया ही नहीं आपने.
Yeah, so introspection, I believe, Dr. Nagpal, is needed. We need to set our priorities of where our focus lies. But quickly, let me also play out the message from the Honorable President of Guyana, what he has said.
Distinguished ministers, healthcare providers, researchers, physicians, and other participants of the WION Healthcare Summit. I bring you warmest greetings from the Cooperative Republic of Guyana. Permit me at the outset to extend my very best wishes to all who are participating in this important summit. It is a pleasure and an honor to be afforded the opportunity to address you remotely and to join this distinguished gathering of minds committed to advancing the future of healthcare. This summit convenes at a defining moment in human history when technology, innovation, science, and human ingenuity are converging to transform the way healthcare is delivered across our world. Indeed, there could hardly be a more fitting example of this transformation than the historic event in Guyana that recently captured global attention. That event was the groundbreaking, longest distance cardiac telesurgery ever performed. From within Guyana, renowned Indian cardiac surgeon Dr. Subir Srivastava successfully conducted a coronary artery bypass craft procedure on a patient located thousands of miles away in India. In doing so, he set a new world record for the longest distance telesurgery ever performed. This sort of removal procedure used to be the stuff of science fiction. Today it is a reality and is allowing us to break down barriers of geography. Think about what this means for medicine, for a surgeon in one continent to perform a procedure on a patient in another country, thousands of miles apart. In terms of healthcare, technology is rewriting geography. For generations, access depended on where you live. Today, access increasingly depends on what we are willing to imagine and build together. That remarkable surgery was not simply a technological achievement. It was a glimpse into the future of healthcare. It was a demonstration that medicine is entering a new era, an era where expertise can travel faster than airplanes, where knowledge can move instantaneously across borders, and where the best care need not be limited by physical location. It also points directly to the direction in which healthcare in Guyana is proceeding. Guyana is undergoing the most ambitious healthcare transformation in our history, and I dare say, in the history of the English-speaking Caribbean, working in partnership with countries across the world, including India, and collaborating with world-class healthcare providers and institutions.
Well, thank you to the Honorable President. And with that, I'm going to wrap this very intriguing session up. But before we go, we're all very religious, very spiritual in this country. Closing remarks, and very briefly, does that help in, stabilizing and balancing our mental health? A little spiritual inclination, the belief in God and such rituals, perhaps, in our daily lives.
So before I answer that, I just want to sensitize this is international platform, the WION, and having this kind of a summit, health summit, is very important. So what the new concept is a brain economy. The brain economy, brain skill and brain capital. That means if your population is mental healthy or brain healthy, your GDP will increase exponentially. So $1 invested in brain health has a return of $11 in the productivity in the GDP. So this is something which is now happening at the global level. I was at the United Nations General Assembly in September last year and UNESCO recently, where everybody is talking about the brain health, brain economy, brain skill. Even McKinsey has now Brain and Mind Institute of their own. So that is something that is happening in the future. In the next 10 years, we will all be working towards making our population brain healthy and mental health healthy. Now coming back to your question about spirituality and the religion, of course the meditation, calm downs, everything helps in making you more healthy in terms of your brain capacity and brain chemicals. With even exercise, now walking is a new medicine, sitting is new smoking. So that is something which we need to be careful, and everything in moderation is helpful. Okay. Excessiveness of religious, I'm sure the psychiatrist friends will tell you, that is also a problem. But certainly, yes, to calm down, your pranayam, your meditation, your yoga, and your faith, which is very, very helpful.
Dr. Nagpal, closing remarks, very briefly, please.
Yeah, I think very pertinent question, because one that we'll all agree that there is a very subtle blurred line between being religious and being spiritual, and we all know that already. Being spiritual is part of being a balance, being into a workable balance in daily life, so that I can be aware and responsible for physical, mental, and social aspect of my health. Is that okay? A balance. Religious, well, up to each one's own ability and need, we can have a faith in a power. It could be God, it could be any other power. And I think that serves as a great anchor for a sense of direction in life and a sense of confidence in life. Why not? whatever I believe in it, whoever is my faith, it could be, India has many gods, we can believe in those. Third part, very importantly, when we look at revision of the whole idea about mental health, do you know that after pandemic, the definition was revised, and today mental health has 4 components. It's not about at all absence of any symptoms. I'm not healthy mentally if I am having no symptoms. I'm mentally healthy only if I'm able to deal with daily challenges of life, nominal daily challenges, बच्चों से लेके बड़ों तक. Second part, am I able to contribute productively and effectively to the environment? We didn't know that. That's mental health. In between, there's another one, which of course, am I able to live to the best of my abilities on a daily basis, whether at school, university, or workplace? So 3 parts constitute WHO's revised definition of health, which takes a ecosystem approach, which includes our spirituality also.
I'll just conclude by saying that in India, health is not a right, but mental health is a right. So we have a Mental Health Care Act 2017, which guarantees that you have an access to the mental health. So mental health is a right.
Oh, this is fantastic.
Yes,
I think a lot of us didn't know that.
Yes.
So thank you for that. I'll wrap it up here. Ladies and gentlemen, can we have a huge round of applause for Dr. Dhamija and Dr. Nagpal, who've been candid. They've been very, honest with us as far as mental health is concerned. Thank you very much, Diksha.
Well, thank you so much, Dr. Dhamija and Dr. Nagpal, for that thought-provoking conversation. May I please request Shreya to bestow our guests with a small token of our appreciation.
I was just asking Dr. Nagpal whether doctors and psychiatrists go through mental health issues or it's just all of us menial beings, but he said yes, he did, and he overcame that. So thank you so much once again to both of you.
And on that note, ladies and gentlemen, it's time for a short break. On the other side, we have 2 fantastic sessions lined up. One exploring the future of AI in healthcare, and another examining the delicate balance between care and cure. We will also be honored to welcome our chief guest for the day, Dr. Jitendra Singh, Union Minister of State, Independent Charge for Science and Technology and Earth Sciences, who will be joining us for a special address at 1:45 p.m. sharp. Lunch is served at Mansingh Hall number 3. Please enjoy, recharge, and join us back here at 1:45. Thank you.